Thank you, Mr. Chairman. Appreciate the discussion here this morning. And Dr. Cadillac, you recognized in response to Senator Warren's question that the challenge that Puerto Rico faced after the devastating hurricane, I mean, it's difficult in an island area where you're not connected, where you're remote. Well, that brings it close home to me. We're not an island in Alaska, but we're not connected to the continental United States, and we are really big, and we don't have a lot of roads. It was just about 75, 78 years ago that we had a diphtheria outbreak in Nome, and we were able to deliver the serum by dog sled. We're not doing that anymore, thankfully, but it does speak to the reality of how you respond when you do have an outbreak, and your ability to move in quickly is limited either because of weather or just access limitations. And we were reminded of this at 9/11 when all the airspace is shut down. Well, you now have 80% of your communities that have no way to get things in and out. A major earthquake that can take out a major port that serves access or airports. And so for us, particularly in Alaska, we've had to be our own little island when it comes to response. But when you're trying to get stockpiles of vaccines or the like, that makes it very, very challenging. Now, I think, I don't recall whether it was you, Dr. Cadillac, or Admiral Redd, mentioned that you can get stockpiles, I believe, of vaccines anywhere in the United States within 12 hours. Did I hear that correctly? And so, should I be worried in a small, remote, not accessible by road, shut out by weather? I mean, we can't even get a state trooper in for 3 days into certain of our villages at certain points in time. What can you do to assure me that we can be that responsive in our more rural areas? That's one part of the question. The other part is when it comes to infrastructure itself. Several years back, we had the first sizable cruise ship going through the Arctic. We had all kinds of emergency preparation drills, and it was not because we were most fearful of an oil spill from a ship that might hit the ice, but an issue on the ship where you now have 500 passengers who need some level of health care, and there's no health care facilities to be had in the region. So for purposes of how we can be responsive when there is a public health crisis, whether it's an outbreak or some kind of a disaster, man-made, natural, or otherwise, what assurances can you give us from these rural states? And I'll turn to Dr. Cadillac and you, Admiral.
Well, thank you, ma'am. That is a challenge. I think the reality is the Strategic National Stockpile can get anywhere to be delivered to the state authorities within 12 hours.
So that would get to our
to Anchorage or, for example, and then it's really the state's responsibilities to basically get those products or those vaccines or drugs to the last terminal mile to those people who need them. And that is an issue that, quite frankly, I think ASPR and the CDC share concern that that's an area where concerted work has to be done because there are other places in the country that probably would have similar challenges. Mm-hmm. Admiral Redd, do you know?
Yes, I think this is a very challenging scenario, and I think that if it were a challenge to move product to a location, there would be other challenges as well. Understanding the problem of the disease in that location, we might have telecommunication, but the access to laboratories, access to epidemiologic investigation, those would also be things that would be limited. So I think this is probably needs to be thought of as a broader set of capabilities that are needed to assure the protection of these populations, not just the stockpile, but medical care and really situational awareness as to what's happening in those locations.
Well, and it is something, of course, that we clearly think about. The last thing I'm going to leave you with, the state of Alaska just conducted an Alaska Health Impact Assessment, and it was the framework based on the current national climate assessment predictions and the impact to Alaska as a state that is seeing the impact of climate change as warming temperatures. You might not feel it here in the East Coast, but it's warmer back home. And it the potential health effects that could be coming our way several decades out. We recognize that. But one of the concerns, of course, is vector-borne, infectious diseases that are particularly associated with vector-borne. Usually we're able to freeze those nasty mosquitoes and they can't move these levels of outbreaks. But it is something that as we think about public health emergencies, we're so focused on the here and the now and the disaster of the day, but I do think it's important that we be thinking long-term about the changes that might be headed our direction.
Thank you, Senator Murkowski.